Good evening, everyone. Glad to see you all here this evening at Pittsburgh Medicare 101. It's our Medicare Made Simple workshop. No sound?
Yeah, we got it now.
Okay, really excited to have you all here. We just doing a sound check. We had some issues a little bit earlier, but we're good to go now. So, as I said, we're really excited tonight to have you all here. We always like to talk about Medicare, and we're also excited because, well, right now it's the 1-year anniversary since we did our last live workshop. We're used to going out to libraries, community centers, churches, fire halls, and spreading the message about Medicare, but we had to stop a year ago. And the good news that really has me excited, we're going to be starting in April again. We're able to go back live and get these out there. So if you want to see us live at some point, you'll be able to go to our website and see when we're available. What we normally do when we have these workshops is, we chat with people beforehand. We get to know them a little bit. So since we're doing this virtually this evening, just go ahead and type your name down in the chat bar. Say hello. Say something so that I know that you're here. And again, so I can welcome you here this evening. So let's see, I have Dee Dee. I'm glad to see that you're here tonight. You're a strong supporter here. Glad to have you. Okay, a couple. Nancy, hi, glad to see you. Keith, glad you're here this evening. A couple other people are typing right now, so we'll let them finish the message. Say hello. Fred, hi, how are you? Lou, glad to see you. And Mary, Ann, and Marcy, I'm so glad that you could be with us this evening. Glad to see you. We have another Mary and Mark. So, okay, I'm glad you guys were all here. I know some of you have been in the lobby waiting. So we're going to get started with the workshop. And the thing I want to let you know is normally if we're doing this live, we just let you ask your question. We found in this virtual format, it's a lot better if we hold your questions until the end. And so if you have a question as we're going through, write it down. We're going to spend as much time as we need at the end of the workshop tonight to make sure all of your questions are answered. So as I said before, this is Pittsburgh Medicare 101. It's our Medicare Made Simple educational workshop. Okay, so I'm going to switch over to the slideshow now and get that started for us. Okay, so just so you guys know that you're in the right place, this is what we're going to be covering today. We're going to go over Medicare Part A and Part B. It's the original Medicare. We're also going to cover Medicare Part C. It's our prescription drug plans, our Advantage plans. We're going to go over Medicare Part D, our prescription drug plans. We'll go over Medigap plans, and probably the most important part tonight is how to get help when you need it with your Medicare. That's what we're going to cover. It's a lot of information, so we're going to get right into it. So I know Medicare is very confusing. There's all of these words. There's a jumble of information out there. You're getting bombarded with mail, television commercials, stuff on the radio, and it's hard to figure out. I understand that. We had a client bring in just a week's worth of mail. If you can see this here, there's quite a bit of things here that you're getting, and all this information is very confusing. I mean, I have a couple clients that we've even gotten them signed up and taken care of already, and they get something that looks real official every couple days, and they call us to make sure that it's not something that they have to worry about. So what we're going to do is we're going to clear up that confusion, get rid of the jumble. Now, I have to get this out of the way right at the very beginning, and I want to let you know that this event is for educational purposes only. We're not going to be trying to sell you anything. Okay, there is no plan-specific details. We're not going to go over benefits of any particular plan. So myself, Bill Pardos, and the team here at Pittsburgh Medicare 101, we are not connected with or endorsed by the U.S. government or federal Medicare program. But that being said, what we are is we are insurance and financial advisors, and we have more than 100 years of experience in the local Medicare market. So the things that we're sharing with you in the workshop tonight, they're some of the things that we've discovered in doing this all that time. We've seen, things that have worked well for clients and things that not. So that's what we're sharing with you this evening. Okay, so as somebody coming up on 65, you should be getting this booklet before too long. It's the Medicare and You booklet. Okay, it comes directly from the federal government, Medicare. This is one of the only official things you're going to get from the government, but as you can see, it's quite thick. This book has about 128 pages in it, and every single thing that you wanted to know about Medicare is in here, and it's packed full of information, but it was written by somebody with the government, so it's not the easiest read. Sometimes it's quite difficult to get through, so we have the condensed version of that, and we're going to cover all the major things you need to know from that Medicare and You book. Okay, so the other thing we're going to touch on just very briefly, something important to look out for when you're coming up on 65 is your Medicare card, okay? And it's going to have your name on it, your new Medicare number, and the date your Part A and B coverage start. Now, the reason I bring this up is because the envelope it comes in looks a lot less official than all of that other stuff you're getting, and it's very easy to throw out. We don't want you to do that, because then you got to go and order a new Medicare card and wait for that to come. So what we tell people, starting about 3 months before you turn 65, make sure you at least open all the mail before you throw it out, because it may be something that you need. So who here feels like this guy standing in front of the Medicare maze? You know that there's lots of twists and turns. You know that you could maybe hit a dead end, have to backtrack. You do know that there's an end to the maze at some point, but if you're like most people, you want to get through it as easily and quickly as possible. So we have the map to that maze, and we say it as a joke, but we kind of really do. So, some of the things that we're going to cover tonight to get you through that maze, just to confirm, we're going to go over Medicare A and B. We're going to go over Medicare C, the Advantage plans, Part D, the drug plans, prescription drugs, and your Medicare supplement or Medigap plans. So what exactly is Medicare? So Medicare is health insurance for 3 groups of people. It's for people age 65 and older. It's for people that are under 65 that have certain disabilities. And if you have end-stage renal disease at any age, then you're going to qualify for Medicare as well. Now, Medicare is administered by the Centers for Medicare and Medicaid Services under some pretty strict guidelines and rules. And the first one of those rules is, in order to get Medicare A and or B, you do have to be a U.S. citizen or lawfully present in the United States. So there's a difference here between Medicare and Medicaid. They're not interchangeable. Sometimes people use the terms to mean the same thing. So basically, real simply, Medicare is an entitlement and health insurance program for those 3 groups of people that I just mentioned a couple slides back. Where on the other hand, Medicaid, it's a joint federal and state program, and it pays medical care for those people that have limited income and financial resources. So a person that qualifies for both Medicare and Medicaid, they're called a dual eligible person. Both of these programs, again, they're administered by the Centers for Medicare and Medicaid Services. So what is Medicare? So there's only 2 parts to original Medicare. There's Medicare Part A, which is our hospital care. It's basically what goes on in that facility. And then Part B are the medical services. It pays for the providers that do those services, your doctors, your physical therapists. Those kind of folks are covered under Medicare Part B. And that's all there is to original Medicare. Now, the important thing that you have to know about Medicare Part A and Part B, if that's the only coverage you have, it's not going to pay 100% of your medical costs. In fact, it's going to leave some pretty big potential liabilities if something happens to you. So some of the things that we're going to get into a little bit later is some ways to cover the costs that's not taken care of by Medicare Part A and Medicare Part B. So what exactly is Medicare Part A? So that's our hospital insurance. And for most people, there are no premiums due for that. In order to get Medicare Part A and not have to pay a premium, you must have worked for at least 10 years or 40 quarters and had FICA taxes deducted from your paycheck during that time. So you'll get it once you turn 65, or if you meet one of those conditions to be eligible prior to 65, then you'll be covered with it as well. Now, what if you didn't work 10 years or 40 quarters? Well, as long as your spouse did, you can get covered under their work record. But if neither you nor your spouse worked the 10 years or 40 quarters, you can buy Medicare Part A. You'll get to purchase it. And again, the thing we have to mention, you have to be a U.S. citizen or lawfully present in the United States. Well, what exactly does Medicare Part A cover? Okay, so Medicare Part A covers the cost of a semi-private room. It covers hospital services and supplies. It covers the nursing care and meals. And it covers all of the blood that you need except for the first 3 pints. If you happen to need inpatient mental health care, then it's limited to 190 days of coverage, but it will pay for 190 days of inpatient mental health care. And then it provides coverage in 90-day blocks. Okay, so if you're in the hospital for longer than 90 consecutive days, then they'll give you an additional 60 lifetime reserve days. So if you're very unfortunate and need 150 days in a row in the hospital, it'll pay for up to that 150 days. Now, those lifetime reserve days, once you've used them, they're gone away. You can't get those back. But those 90-day blocks of coverage, they keep renewing once per calendar quarter. So you don't really run out, and quite truthfully, it's pretty rare when we see somebody get in and start needing to use the lifetime reserve days. Now, something that Medicare excludes, it excludes private duty nursing, and it excludes your comfort and convenience items. And you might say, what's a convenience item? Well, it's a television. It's in your room. That's not going to be covered by Medicare. That's something you're going to have to pick up on your own if you want to watch the TV. Now, I told you a little bit earlier on that Medicare A and B does not pay 100% of your expenses. So these are the gaps. This is the thing that Medicare Part A doesn't cover. So day 1 through 60 in the hospital, Medicare will pay all but the first $1,484 of that 60-day stay. Now, if you're in the hospital for longer than 60 days in a row, day 61 through day 90, Medicare will pay all but the first $371 of each day in the hospital. And then day 91 through day 150, Medicare pays all but the first $742 of each day. Now that day 1 through 60 charge, okay, that $1,484, if you could come up once per calendar quarter if you're unlucky with when you need to go in the hospital. So say you were to go in the hospital in February, $1,484 would be due before Medicare starts paying their portion of the bill. You're out of the hospital, you're fine until June. It's a new calendar quarter. So again, there's going to be another $1,484 due. So it's important that you have something to fill in that gap if you end up going to the hospital a couple times. Now, as far as skilled nursing facilities go, a skilled nursing home, Medicare pays for the first 20 days in full as long as you had a hospital stay right before that. Day 21 through day 100, Medicare pays all but the first $185.50 of each day, and after 100 days, they pay nothing. So, and again, this is important to note, it's skilled nursing care where a doctor and nurse is on staff, and it doesn't pay for it doesn't pay for assisted living, it doesn't pay for in-home care. So if you need those kinds of things, you're either going to have to pay for that with your own assets or have some kind of other plan, insurance plan to take care of those needs. And pretty much in a nutshell, that's all there is to Medicare Part A. Now, Medicare Part B, that covers the providers. And for that, Medicare is going to deduct from your Social Security check to pay for it. Well, at least that's how they pretty much used to do it. Truth be told, most people are not taking retirement at age 65 now. So until you start taking your Social Security check, you will have to pay Medicare yourself for your Part B premiums. And when you go on Social Security, Medicare will deduct that directly from your Social Security check. Now, if you're one of those people we talked about, the dual eligible program, folks that qualify for the Medicaid program, then your state will pay for those premiums for your Medicare Part B as long as you meet the financial guidelines set up by that state. So enrolling in Part B is very important that you do it at the right time. It's so important. We're going to cover 3 slides or devote 3 slides to it, because here's the thing. Medicare says Part B is optional. Medicare Part B, though, is only optional if you have some other kind of coverage that's credible, say like employer coverage or retiree coverage. Now, here's the thing. If you don't sign up for Medicare Part B and at the right time and have credible coverage, you will have a 10% penalty for each full 12 months that you were supposed to have Part B that didn't. That penalty is for life. So it could be a very significant thing if you've missed a couple years. And unfortunately, every now and again, we'll run into somebody that's missed enrolling because they thought they had credible coverage. They got some wrong information. The worst I've seen so far is somebody didn't enroll for 12 years, so they had a 120% penalty for life. So there's no reason to enroll at the wrong time. We don't want you to have a penalty. That's why we're going to hit on this hard. Now, the first time you can enroll in Medicare Part B is your initial enrollment period, and that starts 3 months before the month you turn 65. It is the month you turn 65, and then extends for 3 months after. Now, if you have coverage through an employer, then you do not have to enroll in Part B during that initial enrollment period. What you will do is you'll wait till you come off your employer coverage, and then you qualify for a special enrollment period. Okay, and you can come off your employer group coverage at that point. The only thing you have to do is provide proof that you had coverage, and you can enroll in Medicare with no loss of benefits and no penalty. Now, say you missed your initial enrollment period, you miss your special enrollment period. There's only one other time each year when you can get in Medicare, and that's from January 1st through March 31st of each year. And if you wait till then to enroll, you're pretty certain that you're going to be facing a penalty, because your Medicare coverage then will not start until July 1st of that year. With Medicare Part B, there's an annual deductible, and in 2021, it's $203. So you have to pay the first $203 for Medicare Part B, and then after that, Medicare starts paying. Okay, they pay 80% and you pay 20%, and there's no out-of-pocket limit there. So if you're unfortunate enough to need to go to the doctor a lot and you have to keep paying that 20%, it could be significant. So again, here's another a chart of when you should enroll in Medicare Part B. And what we normally recommend is, if you know you're going to take it when you turn 65, you start the process 3 months before you turn 65. And as long as you do that, you enroll in month 3, 2, or 1 before you turn 65, then your coverage will start the first day of the month that you turn 65. Okay, however, if you wait till the month you turn 65 or those 3 months after, there could be a delay up to 6 months of when your Medicare Part B coverage actually starts. You can enroll in your premium-free Part A anytime after your initial enrollment period begins. But if you have to pay a premium for Part A or your Part B, you can only enroll during those valid times: the initial enrollment period, your special enrollment period, or the annual open enrollment period. And again, lifetime penalty if you don't get into Medicare Part B when you're supposed to. So again, we don't want you to face a penalty. Absolutely no reason you should have to face that. One last time, not to beat a dead horse, but if your birthday falls in the month of April, the earliest you can enroll is January 1st of that year. The latest you can enroll is July 31st. And you can choose any type of Medicare plan that's out there during this initial enrollment period. Okay, so that's pretty much how Medicare Part B works. Medicare Part D are prescription drug plans. Okay, so once you turn 65 or go on Medicare, this is the only way you can get your medications, and there's only 2 ways to do that. One is if you keep original Medicare, you can get a standalone prescription drug plan. If you go and have private insurance provide your Medicare coverage, you can get what's called a Medicare Advantage prescription drug plan, and your drug coverage will be included right with the medical coverage. And these are the only 2 ways that you can get your drugs once you're on Medicare. So who's eligible for Part D? There's lots of questions with Part D, but this is one of the easy things where there's not a lot of questions. So basically anybody who's entitled to Part A and or is already enrolled in Part B can get Medicare Part D. Now here's the thing though, you have to permanently reside in the area where the plan is sold. So in Western Pennsylvania, we can choose from 30 Part D plans, and those are the only plans you can buy. I mean, we run into situations a lot of times where somebody travels, they maybe live 4, 5, 6 months of the year outside of the Pittsburgh area and see a plan in that area that's maybe more attractive. Their drugs are covered better than the plans available in Western Pennsylvania. Well, unless your permanent residence is that place where you're vacationing, you can't get one of those plans. You have to get a Western Pennsylvania plan. Now, again, those people that are dual eligible can get a Part D plan. And here's another unfortunate penalty that comes up, okay? So Medicare Part D, if you don't enroll in one of those plans where you're supposed to, there will be a lifetime penalty there as well. And unfortunately, it's worse than that Part B penalty. It's 1% per month until you sign up and get a Part D plan. And again, it's a lifetime penalty. What we're running into fairly frequently, I can't say pretty often, is we're getting a lot of healthy 65-year-olds come in and they're not taking any medications, or they're maybe taking a couple of very inexpensive medicines that just cost a couple dollars. And the question we're always asked is, well, why should I pay for a prescription drug plan when I'm not taking anything? Well, you're paying for a prescription drug plan to avoid a lifetime penalty, because it's pretty inevitable that you're going to be taking some medicine at some point in time in the future, and you don't want to be faced with a hefty penalty when you do sign up for that plan. Now, there are a few groups of people that don't need to get Medicare Part D. And for example, if you get your drugs from the VA, if you have VA drug benefits, or if you have an employer or retiree plan that offers drug benefits that are credible, then you don't have to go ahead and duplicate that with a Medicare Part D plan. And this is what we always get a lot of questions about. It's confusing because Medicare changes the rules for how the drugs are paid for under Part D every single year. So what we're going to talk about here is the standard plan that drug companies are supposed to offer coverage at least this good. And how it's supposed to work in 2021 is there's a $445 deductible that you, the client, are supposed to pay for at 100%. However, the truth is, in Western Pennsylvania, we have a lot of plans that are better than required, and they will not charge you that deductible if you're taking Tier 1 or Tier 2 medications. So if you're taking Tier 1 or 2 medications only, most often you'll pay $0 or a couple dollars for those drugs. Once the $445 deductible is satisfied, then you're in the initial coverage phase, and that lasts until both you and the insurance company have paid a total of $4,130. Now, while you're in that phase, you will pay 25% of the cost of medications if you're not taking a Tier 1 or 2 drug. Once the total cost of the medication you're taking goes past $41.30, you fall into what used to be called the donut hole. Now, that used to be bad because you used to have to pay a higher percentage when you were in the donut hole. But right now, you're still paying 25% of the cost of the drugs. What has changed in the donut hole is who pays the other 75%. And it's something you don't really need to worry about because it just creates a little bit of extra confusion. Now, once both you and the insurance company or the drug company has paid a total of $6,550, now the cost of your drugs drops down to only 5%. They consider it, if you're paying $6,550 in prescription costs, that you're in catastrophic coverage. So at that point, your drugs, again, drop down to only 5%. Now, again, we get a lot of questions on this because it changes every year. So we're going to have the accurate, up-to-date information for you every year. And because of these plans changing with the drugs every year, the people that work with us, this is the only time of year where we pester them and get in touch with them, because we want to make sure that you're not taking drugs that your current plan doesn't cover well, or sometimes the plans change. So we always want to make sure that you're in the plan that costs the least amount of money. So that concludes our real quick discussion of the parts of Medicare A, B, and D. And this is why most of you came here tonight, is the choices that you have when you're picking coverage, because this is the most confusing thing that you're going to have to face. Okay, so you have two, I guess, paths that you can go down when you turn 65 and pick Medicare. And the first is if you decide to keep original Medicare, and that's going to be the blue side of the slide, and you get something to fill in those gaps that we talked about. Now, one of the ways that you can stay with original Medicare and get those things paid for that Medicare doesn't is if you happen to have employee or retiree group coverage. Now, the thing you have to look at with those is you have to check with your HR and make sure, because they may require you to have Medicare Part A and B, and sometimes the drug plans aren't included with those retiree group plans, so you have to check. Now, if you don't have that option available, no employer coverage or retiree coverage, you can stay with original Medicare and get a Medigap plan. Now, there are plans A through N, and they require you to have Medicare Part A and B. And in order to get your drugs, you will have to get a drug plan separately there. Now, there are Medicare plans A through N, but most people in Western Pennsylvania get Plan G because it's most comprehensive, and I'll show you that in a second. And for the rest of this evening, when we talk about Medigap, we'll be talking about Plan G, just to make sure it's not confusing. Now, the other option you have is if you go at the red side, a Medicare Advantage plan. And that's where you enter into a contract with a private insurance company. Now, these private insurance companies have a special arrangement with Medicare. They have a contract where they're going to provide coverage that's at least as good as original Medicare, and they're going to include the drugs in with that. Now, over the years, what we've seen happen is they've added a lot of things to that coverage as well. So those plans are getting to be quite, I want to say, robust. They have a lot of benefits in them. In Western Pennsylvania, where most of our attendees are this evening at the webinar, we're going to see only HMO and PPO types of plans. Now, all the plans that we see in the area, with the exception of a few, include the drugs right along with them. A few plans you have to get your drugs elsewhere or separately. Now, the other option is if you are a dual eligible person that's eligible for both Medicare and Medicaid, you can usually get an HMO Medicare Advantage plan. Now, this fork in the road, it's kind of the first place where we see people make mistakes and make errors that could cost them big in the long run. And the first error that we see people make, or first a misstep, is they've maybe worked for a company for 25, 30 years, and they have had the same insurance company that whole time, and it's worked well for them. So the common sense thought is, hey, I've had good luck with this insurance company, I'm going to look at their Medicare options. Well, that could be a mistake, because the plans that are designed for the employers, the group plans, they're put together totally differently than the Medicare plans are. They're designed to offer coverage to families. They're designed to have maternity coverage, cover children, and all those kind of problems. And if you just go with that company's Medicare plan when you turn 65, you're going to find out it covers a whole lot differently, or maybe a whole lot more expensive than that plan that was available through your employer. And when you go to use it, it'll be an unpleasant surprise. The other thing that we see that a lot of times is you may listen to a friend that's a couple years older and has already gone through down the path to get Medicare. And for whatever reason, when we're doing these workshops live in a library somewhere, or even the webinars, we normally pick on Sally. And I don't think we have any Sallys in here tonight. I can't see the names of all the attendees, but if we do, I apologize. I'm not picking on you in particular, but you listen to your friend Sally, and she's researched it. She's real knowledgeable. She uses the doctor a lot, and she kind of forces you to really consider her plan. She's very persuasive, I guess you could say, and you get the plan that Sally has. Well, here's the thing. You go to use it, you go to your doctor on January 2nd and find out he's not in network. You want to go to the hospital group that you like to go to, and they're not in network. and then you're, say, maybe in Florida visiting your grandkids, and there's nobody there that accepts your insurance, and you're going to be quite upset. Well, here's the thing. There's not anybody that's watching us on the webinar tonight that has the same exact medical conditions, drugs, that likes the same doctor, or even the health network as the other people on the webinar tonight. We're all individuals. We have individual needs. And it turns out Sally goes to the doctor that's a block away from her house because she can walk there. She goes to the hospital that's a mile away because that's where she's always gone since she's been a little girl. And she hardly ever goes even to downtown Pittsburgh. So she doesn't need a plan that covers her anywhere other than this maybe 2-mile radius. Where you, on the other hand, may like to travel. You don't like Sally's network or her doctor, and maybe Sally's taking a bunch of medications and you're taking none. So the moral of the story is you want to make sure that you get a plan that's customized to what's important to you. You get a plan that checks off all of your boxes. So you can't listen to Sally. Yeah, you take her advice, but look on your own for a plan. Okay, so what we're go on. So we're going to go into the Medigap plans now. So here's the thing in Western Pennsylvania. There are 60 carriers with the same exact Plan G, okay? And I want you to write this down for later when I get into something that always comes up, okay? So all of these Plan Gs are offered under strict guidelines that Medicare sets up. So every one of those Plan Gs are going to have an identical set of benefits. They're going to be identical. Okay, so again, Plan G coverage offered by any of those carriers will be the same. So there are 9 plans, okay, A through N. They're going to be identical in 47 states. 3 states don't follow those rules. But again, we're going to talk mainly about Plan G because that's what most people get when they go the route of having original Medicare and getting a Medigap. Now, all the mail that you're getting, probably all the booklets are going to have some form of this chart in it, and it shows what the Medigap plans covered. Now, all those things that I talked about earlier on in the webinar, where there's Medicare pays all but, Medicare doesn't pay for day 61 through day 90, the first $352. They don't pay the first, the 20%. So all these check boxes are the things that are covered. That Medicare doesn't cover. And if you look down Plan G, you can see the only thing Medicare the Medigap plans don't cover is the Part B deductible, which is $203. So it's a very comprehensive plan. And the other important thing that it covers is if you travel outside of Pennsylvania or a state where the doctors don't have to accept the Medicare approved amount. So that's why people look at Plan G. And again, it's a very confusing chart, but like I said, the check boxes are things that are covered. Next, we're going to talk about the Medicare Advantage plans, okay? And those are, again, private insurance companies that are taking over for your Medicare coverage. And in Allegheny County, this year we have 7 different insurance companies that offer 45 different plans. In Butler, Westmoreland County, we have the same 7 insurance carriers, but they offer 46 plans. What I like to say in our area, we're blessed and we're cursed with when it comes to making these Medicare choices. We're blessed because we have 2 really good, strong health networks in the area. We're cursed because we have so many choices of plans. Okay, most people in the United States have a choice of maybe 20 plans. We have more than double that. Some areas of California might only have 10 or 12 plans because we've looked for people there before. So it makes the choice difficult because there are so many options. So when can you get into a Medicare Advantage plan? So there are only certain times of year when you can get into a Medicare Advantage plan. And the first of those is that initial election period, that 7-month period around when you first turn 65. The other period of time when you can get into an Advantage plan is during the annual election period. And that goes October 15th till December 7th. And you're going to be well aware of when this period of time is because every single commercial on television from 4 a.m. in the morning till probably midnight is about some kind of Medicare health plan. I mean, you'll just tune it out. You hear it so often. But that's a period of time where you can get into a Medicare Advantage plan or change your Medicare Advantage plan. And there's one, excuse me, one other period of time where if you have a Medicare Advantage plan, you can make one change, okay? And that's January 1st through March 31st, and that's the annual open enrollment period. Now, during that period of time, you can switch your Medicare Advantage plan once. So say you listened to Sally, you picked her plan and found out on January 3rd it doesn't work. Well, you can change back to your old plan or pick a new plan that works better for you. You can also choose to go back to original Medicare and get a Medigap plan. Okay, now here's the important thing with those Medicare supplement plans, the Medigap plans. During your initial enrollment period, they cannot ask you any health questions. They have to take you regardless of how good or how bad your health is. But after that initial enrollment period ends with the GAP plans, if you want to switch, they can ask health questions and they can say no to accepting you for coverage. So the Advantage plans, they can not decline you for any reason as long as you're in a valid enrollment period. I mean, you could have just had the worst kind of cancer and be sitting there on oxygen smoking a cigarette, and they're going to have to take you as long as you're in a valid election period. So what we tell people is if you decide you want to go back to original Medicare, let's check to make sure that there's a plan out there that will take you, and that has gotten easier over time before you leave Medicare Advantage and find yourself in a situation where you have no coverage. Now, if you have a Medicare Advantage plan, there is one other period of time when you can make a new choice. And that's if you move out of this area or your home area and you will lose your coverage for that reason. You can pick a plan that's available in your new area. So, people, we always like to put these plans side by side. What is right for me? So we're going to put the Medicare and Medigap plan next to the Medicare Advantage. So, some of the reasons that people like the Medicare and the Medigap plans is all doctors and all hospitals in the USA are going to take your coverage if you go that route. As long as the doctor takes Medicare, he's going to take the Medigap plan as well. Medicare Advantage, they do have networks, okay? So the HMOs, they require you to stay in network. If you leave network, you're not going to have payment for your health services. Where the PPOs, they'll let you see any doctor, even if it's outside the network, as long as you agree to pay a little bit more money to see an out-of-network doctor. With Medicare and a Medigap Plan G, there's not going to be any copays. Okay, where there are copays with the Advantage plans. They are shared expense plans. Somebody that's healthy that doesn't go to the doctor a lot, that may be a reason they look at that option. With Medicare and Medigap Plan G, there will be the Part B deductible that you have to pay, and that is $203 this year. Okay, with the Medicare Advantage, there is no deductible. Most of the plans we have in Western Pennsylvania have a $0 deductible. Now, if you leave Western Pennsylvania and get in other areas, some other areas have small deductibles in their plans, but we're fortunate here to have no deductibles. Now, with Medicare and Plan G, once you've paid the Part B deductible, there's not going to be any more out-of-pocket expenses. Everything else, other than your drugs, will be paid for on that route. Whereas with the Medicare Advantage, there will be some out-of-pocket expenses. That's going to vary based on the plan and how much you use it. I mean, how sick you are and how often you need to go to the doctor or hospital. With Medicare and a Medigap plan, you will have to add prescription drug coverage if you don't have something like, say, from the VA. Whereas with the Medicare Advantage plans, the prescription drug are usually rolled right into those plans, and you don't have to worry about looking for a separate plan. Now, why would somebody pick Medicare and Medigap? Well, the most popular reasons people go that route is they feel they have more freedom of choice. They can use any doctor or hospital in the U.S. They like the fact that there's no copays and no referrals in most instances, and that's important to them. Whereas, on the other hand, the Medicare Advantage, the reason somebody would pick that plan is they're already familiar with and happy with the doctors and networks in that plan they choose. The big reason people like the Medicare Advantage is the premiums are low. In some instances, there are $0 plans that offer very good coverage and very good benefits. As I said earlier, the prescription drugs are rolled right in those Advantage plans, and in people's minds, it's simpler to use. Now, there's not one of these options that's more right or more wrong than the other. It depends on your personal situation, what checks off most of the boxes that are important to you. And again, that's why it's important to kind of get an idea of what you think is most important. And then in Western Pennsylvania, at least, it's pretty easy to customize a plan that's suitable for you. Now, what we like to do is do a comparison of talking to an unbiased advisor versus going directly to an insurance company or an agent that works only for one insurance carrier. And the advantage of going with an unbiased advisor, and I can say a little bit about this is because that's the category we fall into, is they're going to offer coverage through all the Medigap and Medicare Advantage and prescription drug carriers, and they're going to know everything about all those carriers. Whereas on the other hand, you're going directly to an insurance company, you're only going to get knowledge of the plans that they offer. There's going to be limited plan choices. The unbiased advisor is going to take time to discover what's important to you with your medical and health coverage. Whereas going directly to an insurance company, they're going to tell you how close they can come to what's important to you. I mean, maybe if you're lucky, they'll have a plan that fully suits your needs, but most often there's going to be compromises because they only have a limited number of choices. When you go to an unbiased advisor, you can come up with a personalized coverage plan and select the best options from all the carriers out there that are available. Whereas going to a single insurance company, again, limited choice of plans. You're only going to have a choice of plans offered by that one company. With going to an unbiased advisor, you can compare plans from different carriers by side. You can say, what if I move and need to change plans? What if I get sick, or what if my drug goes up? We can run all those scenarios for you. Whereas going directly to an insurance company, there's going to be no comparisons. And here's the thing, they're not going to share with you if the competitor's plan works better or offers the things that you say you need. This is where I compare it to car shopping. Say you're in the market for a new pickup truck and you find yourself on the lot of a Ford dealership. Well, that salesman is willing to tell you everything that's great about that Ford. Going to tell you that one thing that's really important to you is offered on maybe a GMC or on a Dodge Ram pickup. It's just not going to share that information with you. So again, it's important to have somebody that's going to share all the choices with you. Okay, again, the unbiased advisor, again, it's important to have annual personalized follow-up because what's important to you could change. Your health could change. Your medications could change, and the plan that's working for you this year may be the worst possible option for you next year, okay? Whereas if you have your coverage and have only dealt directly with an insurance company, the only thing you're going to get from them is how your plan is changing for the next plan year. They're not going to tell you that something may suit your needs better. In fact, we've seen one big carrier in the area keep people on a plan that's very expensive when they have a plan that costs half as much that offers the same identical benefits. So it's kind of a crime, but I'm not going to mention any names. But that's, unfortunately, if you go direct to an insurance company, what is possible that it could happen. Now, the other thing that happens is people will go online and they'll fill out a form, they'll request some information, they'll get something in the mail, and somebody's going to call you on the phone from an area code you do not recognize. So why should you deal with somebody that's here in the area as opposed to somebody that's calling you from Kansas City, Florida, Oregon, Colorado, who knows where? Well, for example, we have 100 years of experience in the local Western Pennsylvania market. We talk to our clients every year at their annual review. We talk to them during the year, and we know what kind of experience they have. We know if one company's hard to get through with customer service. We know if they're able to solve your question easily and quickly, and we know who's bad. Okay, whereas that distant advisor, he's selling plans all across the country in maybe 48 out of 50 states, and he's not going to have specific knowledge of how anybody's plan works out for them. He doesn't know what plans local clients like. Okay, again, we're going to have access to all the local plans information. We know if two insurance carriers are fighting, if there is limited network access, and that distant advisor, again, he's only going to have access to a few companies' information. He's only going to tell you about what they have to offer, not all the plans that are in our area. Local advisor, we can show you details for all the plans. We have no incentive to put you with one insurance plan over another. We're paid the same regardless of who you go with. Whereas that distant advisor that calls you on the phone, again, limited choice of plans, and he may have an incentive to offer you information on one plan over another plan. Here's probably the most important thing. You can find us. We're local. We've been in the North Hills here right off of McKnight Road for quite a few years now. Many of our clients choose to come right into our office, and when we're doing our visits, to help them and sit down. We have a cup of coffee with them, get to know them, and you can find us when there's an issue, if there ever is. Whereas on the other hand, that distant advisor, the big thing is, where the heck are they? They could be thousands of miles away. There could be lots of turnover at their company, and the guy that you talk to today may not be there 3 months from now, and whoever picks up the phone have no idea what you talked about or were promised. Again, another important thing is annual personalized follow-up. Your situation could have changed. Where that distant advisor, there's not going to be any follow-up in most cases. So what's it going to cost? Now, this is what people, the most important thing that many people think is, when they're making this decision. So again, we're going to put the Medicare and Medigap options side by side with the Medicare Advantage plans. So both plans require you to have Medicare Part A, and there's going to be $0 cost for that. So that's the same whether you have Medicare and Medigap or a Medicare Advantage plan. Okay, the Medicare Part B, for most people in 2021, it's $148.50. Both choices require you to have Medicare Part B. Now, there are certain high-income individuals that there will be a surcharge for the Medicare Part B, and that surcharge is based on your annual income. So Medigap Plan G, what's that going to cost? Now, this is the thing I told you to write down earlier, that all plans offer identical benefits. So in Western Pennsylvania, we're seeing Medigap Plan G plans come in for anywhere from $94 to $200 and around $201, $205 a month. Now, why would you pay $205 for a plan of insurance that's identical to a plan that's maybe $100? The only reason I can guess is that you weren't told about the plan that costs $95, $100 when you bought that $200 plan. So again, it's important to have all that information in front of you when you make that decision. Now, what do the Advantage plans cost? Well, there's lots of good Advantage plans out there that cost $0. Okay, but they also go the whole way up to over $200. And this is one of those situations with the Advantage plans where paying more money does not get you more or better benefits, more or better access to customer service or doctors. In some cases lately, we've seen plans that cost less than $50 have way better benefits than $200 plans. So again, why would you end up with a $200 plan? Most times it's because an advisor didn't say that there's a better plan that's less money, or wasn't really insistent on showing you the difference and showing you why a $50 plan offers more than a $200 plan. Medicare and Medigap Plan G, there will be the Part B deductible that you have to pay, the $203 once per year. Whereas on the Advantage side, there is no deductible. Okay, you will have to pay for your Part D plan with Medicare, and they run anywhere from $7 to up to $100. But normally, most people come in the $7 to $25 range with your Part D insurance plan. The Medicare Advantage side, the Part D is included, so there's no additional cost for most plans. So what's the monthly bottom line? So with your Medicare and Medigap plan, you have your $148.50 Part B premium each month. You have your Medigap premium, say $100, and then your Part D and any drugs. So, if you're a person that likes to budget and budget right down to the penny, it's a little bit easier to figure out with Original Medicare and a Medigap plan. Now, Medicare Advantage plan, you do have to add in doctor copays, hospital copays, your prescription drug copays, just like with Original Medicare. So the more you need coverage, the more you need to go to the doctor or hospital, the more you're going to pay with a Medicare Advantage. Okay. But again, a lot of times people weigh it out, and in their mind, they're coming out ahead when they're doing that equation. Again, one's not better than another. It's just what's best for you. Now, we really harped earlier on the importance of enrolling in Medicare Part B at the right time. So when should you enroll in Medicare? So there's three situations we run into all the time. And the first of those is if you're still working and covered under your employer's group plan. The second is if you're collecting Social Security. And the third is if you're not already collecting Social Security. Okay, so the first thing we're going to look at is if you're still working and you're covered under your employer's group health insurance. Now, you have two choices, okay? You can stay with your employer coverage. You can delay your enrollment in Medicare Part B, and there's not going to be any penalties, and you're not going to have your options restricted for you. Okay, but here's the important thing, and we've seen this more and more over the last 24 months, is the cost of the employer plans has gone up. The amount that is being deducted from paychecks has increased, and the plans cover less. They have a high deductible. I mean, the lowest deductible we normally see with employer plans is $1,000. It's more common to see $2,500 or even $5,000 deductible with a high deductible plans. They may have out-of-pocket max anywhere from $7,550 or up to $13,000. So those employer plans are covering less. And so what we normally recommend to people is weigh what the employer plan costs versus Medicare. And more often we're seeing it way less expensive for people to accept Medicare, drop the employer coverage, and end up with better health care coverage in the process. Now, the thing you have to be aware of is, does your spouse or some other family member rely on that employer coverage for their health care? Okay, and we would look at that because most employer plans don't let your spouse stay on once you've dropped it, and once you've dropped it, you can't come back. But we've even seen, like this year especially, where it's been less expensive for the employer to take Medicare insurance and a Medicare health plan and get their spouse coverage on the open market. Now, if you don't have, if you make that choice, you can leave your employer group coverage, enroll in Medicare, and then select either a Medigap or Medicare Advantage plan. Okay, choice two is if you're collecting Social Security already, or situation two. And this is probably the very easiest situation, because what will happen is if you're already collecting Social Security, Medicare is going to send you your Medicare card about 3 months before. And it's going to already have you enrolled in Medicare Part A and B. Now, if you do have employer coverage, like a retiree plan or employer insurance, you can delay your Medicare Part B. It's as simple as checking a box on the back of your Medicare card saying, I want to delay Part B, send it back to Medicare, and they'll send you a card with just Part A. And then you can choose between your, retiree or employer group insurance if it costs less. But again, most times it's not going to anymore. Or if you're going to drop it, you can get a Medigap plan or Medicare Advantage coverage. And here, this is what we see more and more often, because most people aren't taking Social Security at age 65. That used to be real common when it was the full retirement age happened at 65. Right now, full retirement age is 66 years and 2 months, soon to be moving up to 66 and 4 for most of you people turning in the not too distant future, okay? So if you're not collecting Social Security already, now, you want to start this process 90 days before. You have two options, okay? One is go to the Social Security website at ssa.gov and enroll in Medicare. And you want to do this 90 days before your birth month, okay? And I'll tell you why in a second. Now, the other choice pre-pandemic was you would make an appointment with a Social Security office. You would go into that Social Security office and they would put you on somebody on a telephone and they would take care of you enrolling in Medicare. However, Social Security offices are not fully open yet, so they're going to be talking to somebody on the phone anyways, and it may be confusing. Now, if you go to the website, you want to do it 90 days before because you want to make sure you can get into your Social Security account. You want to make sure that they have your birth date and Social Security number correct, and that you haven't been maybe subject to somebody trying to steal your identity, because those are all things that can lock you out of your Social Security account. And if you don't start this 90 days before, if you say you started 3 weeks before and find out you can't get in, then you have to jump through some hoops to make your Medicare start right when you want to. Now, if you don't feel comfortable going online and doing it, we do it here probably 4 or 5 times a week. One of the other guys here in the office jokes that we can do it in our sleep because we really do it for people that come in and we work with that often. Now, if you're doing it on your own, you want to print the final screen that has your reentry number on it, because that verifies that you've enrolled in Medicare at the right time. And if they come back and try to charge you a penalty, you can say, no, can't charge me a penalty. Here's my proof that I did this at the right time. And when we do it here in our office, we print 3 copies. We give the people that we work with 2, and we keep 1 in a safe place just to verify it's been done. Now, once you've enrolled in Medicare, again, you have those same 2 options. You can, stick with your employer coverage or retiree coverage, or get Medigap or a Medicare Advantage plan. So these are some useful websites that they really do help out a lot. They're all government websites. The Medicare.gov is a very useful website. It has a ton of information on. It has information on almost any scenario you can come up with. But again, it's like that 128-page book I showed you earlier on. It's written by somebody with the government, has lots of government language and legalese in it so they can cover themselves, and it may not be the easiest to find things and go through, but it's there, and it is a resource, and we refer to it. The other is mysocialsecurity.gov. It's where you have your My Social Security account. And this is a very good website. It's very easy to use. It shows what your Social Security benefits should be. It also shows when you applied for Medicare and any Social Security benefits. And again, it has good information. It's something the government has gotten right. It's easy to use. And the other one is mymedicare.gov. And I strongly recommend to people, once you sign up for your Medicare, get on Medicare, you set up your mymedicare.gov account, because it will keep track of your prescriptions, when they were filled. It keeps track of your doctor's visits. So that way, if you forget a doctor's name, if you run into a situation where somebody has come into the hospital to see you, you didn't quite catch their name, it's going to be there on the mymedicare.gov site. Anybody that's submitted a claim for you, Medicare will keep track of for your benefit. So who remembers this guy right at the very beginning of the maze? Well, I hope with our workshop tonight, or what we've presented to you, it's been useful, and you feel that there's going to be an easier path through the maze. There's an end point, okay, but you still have a lot of decisions to make, and you might be concerned that there's some wrong turns that you can make. You might have to hit a dead end and backtrack. Well, that's kind of okay. I joked earlier that we have a map to the maze. Well, what we really do, and we like to say with this, is this couple is standing at the finish line. They're happy and smiling because they came to us and worked with us to get through that maze the easiest and quickest way possible. And I know I have people all ages before age 65 here. There's people that are more than 6 months out. And that's okay, If you want to find out what your Medicare options are, and even though you're more than 6 months out, it's okay to talk to us, Because as soon as you have a firm idea of what you're going to do, it's kind of like you can breathe a sigh of relief, because it doesn't seem like a hard decision anymore. You can throw all those things away that you're getting in the mail. You cannot be bothered and confused by them. You can ignore all the commercials on the TV, because you've made your choice. You know what your path is. And I can guarantee once you make that decision, you will feel a lot better. Now, I've kind of mentioned some of the ways we do things differently, why we think it's a good idea for people to work with us. Well, we have exclusive technology. Okay, we're not just some guys from Pittsburgh, even though we are some guys from Pittsburgh. We're part of a much larger organization and company. Okay, we have probably 44 offices nationwide now because we just added some new offices, and probably past 1,000 advisors at this point. And our home office has developed this exclusive technology for us where we can get the information that's important to you about your health. We can get who your doctors are, what hospital network you want to go to, where you like to travel, what your medications are, and what drugstore you like to go to. And we put that in our computer, and then it compares all the plans that are out there available. So all 7 of those carriers, all 45 plans, or all 46 plans, we have it there, and then we put it right in front of you, and we say, okay, this is a good choice, and this is a good choice, and we'll show you why, and you get to see why we think something is a good choice for you. Same thing with the Medigap plans. We have another piece of exclusive technology. There's 60 companies out there, okay, and some are big name companies, and some you've never heard of. And this other piece of technology we can go and see their premium increase history. We know if a company has raised their premiums 7% every year, 6% every year. We also know how many people they have covered in Pennsylvania. So like a big company that has, 20, 30,000 people covered, you're going to have more premium stability than a company that has 5. I mean, because if you look at this, here's 2 plans that are $138 a month. One only has 5 people in Pennsylvania covered and 368 nationwide. This other one has 720. So we're not going to steer you towards a plan like that where you may have premium increases all the time because one of those 5 people got cancer. So, we have some things available that just is not available anywhere else. And we've had people come in and interview to work with us, and they see this and they're like, wow, man, I wish I had that. And truthfully, before we had it, our job was quite difficult because we were putting all these plans side by side on our conference table, and that was the only real way to kind of look at it, and it wasn't always accurate. So again, how we do things differently. Okay, we're going to present the full details of all the choices available. You can ask all the questions you want. You can ask as few questions as you want. But again, we're going to present full details. We represent every one of those companies that offers coverage here in Western Pennsylvania, and we're unbiased. We don't care which plan you go with. We want you to be happy with that plan because we want you to come back next year, the year after that, and tell all your friends about how smart you were with the choice you made. And quite truthfully, if we steer you the wrong way, if we do it for us and not you, then it's going to be a one-shot deal. We don't want that. Here's the other thing that we do for our clients, with that technology. We do that at a Medicare Done For You visit where we get all of your information and find out what's important to you. And here's something that's interesting. It costs you nothing. We have a couple advisors here in the office that have just recently turned 65. So we're kind of Medicare geeks. We go out there and look and see what everybody else is doing. Well, they've gone to some of these webinars where this Medicare, the equivalent of the Medicare Done For You is offered. And we've seen out there where it's being charged as much as $500 per person for it. And it could be a husband and wife in a household, both turning 65. And these other people doing this service will charge each of them $500. The annual reviews where we make sure you're in the right place and doesn't cost anything, they're charging $250 for. Now, we want to be transparent, okay? The carriers will pay us for the Medicare Done For You. We're going to show you all the plan choices, but once we've assisted you with the enrollment and we process the enrollment with that insurance carrier, then the insurance company pays for us providing that Medicare Done For You service. Okay, and again, I do want to emphasize that there's zero cost to that Medicare Done For You. People come in, we do it, and they're saying, like, what can I pay you? Well, you're not going to pay us anything because the Medicare Done For You is paid for by the carriers. And the other thing that we do is, I showed you that big book earlier on. When you come in for your Medicare Done For You, we offer the Navigating Medicare book. It's a 20-page breakdown of that Medicare Done For You. So, that pretty much answers, or finishes up the workshop. We hope that's giving you some information. I'm going to open this up for question and answers. Like I said, we have over 100 years of experience doing this, and we want to make sure that we get you with the right plan. So I'm going to turn the questions on, and I do want you to ask any questions you have. And one of the questions that we always get is, how can I get in? So what I'm going to do is, up at the top of our screen, we're going to put up a way to go right into our schedule and schedule directly with us. That's going to come up right now. And when you do go into schedule, here's the Navigating Medicare book. I guess I want it on this side so you can see it. But when you do go into schedule, it's going to ask you for a choice at 2 times, because sometimes in the past we've had people going in simultaneously try to schedule that appointment. They both think they got it, neither one have it, and it's confusing when 2 people come in that aren't in our schedule. So pick a choice at 2 times. We'll confirm one of those. Okay, so great. So I have our first question here, and it's from Lou. Thanks. That's a really great question. Lou, can we really help you sign up for Part B? And that's absolute yes. We're more than happy to do it. Like I said, we do it 5-10 times a week. We will take you to the Medicare site. We will do that online enrollment for you, the same thing that the Social Security people are doing over the phone for you. If we run into an issue, if there's an issue with, like, maybe your Social Security number's wrong, birth date's wrong, then we can get you the number that you need to call and get that fixed pretty quickly. And here's the other thing is, if you take your Medicare Part A, you're delaying your employer coverage, then when you decide to take Medicare Part B, we have the easiest way available for you to get those forms and then get them off to Medicare to get your Part B started. So very good. Nice presentation. This is a comment. Well, thank you very much, and I look forward to seeing you, M&M. So, Nancy, you're located in Erie, PA. Do we have a representative there? Yes, I'm glad to say we do have somebody that's very close to you. We have an office in the north. Can't quite say where that location is here online because they're not participating tonight, but we can get you to a person that's going to take good care of you there and do exactly what we do. He also represents all the carriers and all the companies, and total confidence that he's going to do a good job for you. And again, if I don't answer your question well enough, clearly enough, then just pound it out again. I am glad. And okay, thank you. So Mark, again, thank you for your kind comment. I look forward to seeing you when the weather's a little bit warmer here, because you're planning on seeing us in the summer. Good. I look forward to it. If you want to get that thing in the schedule now, if you know when it is, go ahead and click that. Otherwise, just let us know that you're interested, and we'll help you keep track of when it's time for you to come in. Lou, how do I schedule an appointment with you during this crazy time? Well, okay, so we want to make it as easy for you as possible, okay? So if you're not comfortable coming to our office, we can do this virtually. We do it online. We can handle the signatures that you need to make for your coverage electronically. And if you're not comfortable electronically, you're not computer savvy, we have guys that live all over Western Pennsylvania. I shouldn't say guys, because we have female advisors too. It's just a figure of speech, but we can get somebody to you. Okay, you can use the scheduling link at the top of the page. Okay, you can call the number when the webinar is over. We're going to have our numbers posted at the end, and we're also going to be sending you a follow-up email. We're going to have a way to have a recording of this webinar. Maybe if you didn't catch something, if you need to go back over it, you will have access to that, and it will have every potential way you can schedule with us there. And again, when you do schedule that appointment, when you get in, we will get you this copy, either a hard copy or an electronic copy of our Navigating Medicare booklet. Okay, so Daniel, great question. Okay, if you work, hey, during your birthday IEP and pick your employer's health plan, then in the next year, age 66 or 67, decide to Medicare, do you just apply? Well, that's pretty much how it works. Now, there is an additional step. When you do want to leave your employer's coverage, you do have to get a form signed that Medicare provides, or we have it here in the office, that your employer fills out that when your coverage started and when it's planning on ending. And then we can upload that electronically to Medicare, and that's what has to start your Medicare Part B coverage, because the way getting that that gap coverage, that drug coverage, that advantage coverage working, they will not activate your coverage until you have Medicare Part B. So the first step in the process is to activate your Part B with Medicare. Again, as long as you have that credible employer coverage, there will be no penalties, and we'll get your Part B started, and then we can do whatever else you want as far as the other options there. So I hope I answered that for you, Daniel. If not, like I said, I'm more than happy to go into more detail. So Medigap plan, you can go to any doctor, and that's a question from Lou, and that is absolutely correct. As long as that doctor takes Medicare, and they will take the Medigap plans. Now, there will be a few doctors that don't take Medicare, don't participate, and they're going to be your very high-end orthopedic surgeons, the ones that treat professional athletes, say, the Pirates, the Penguins, the Steelers, those kind of guys. They don't need to see Medicare people. Cosmetic surgeons and cosmetic surgery is not going to be covered, and pediatrics is not going to be covered. So, but probably 96% of all the doctors are going to take Medicare and take those gap plans. So I hope that, Nancy, you are certainly welcome. We are glad you could attend this evening. Glad you have us. And again, I do want to mention for those people here that are local, we will be starting workshops in the north of Pittsburgh in April, and we'll be expanding east and south in May. And then if you want to see what we look like in person, then you're able to see us and fire away at questions there. So again, Nancy, thank you for coming. You're certainly welcome for being here. Again, when you sign up, schedule for a Medicare Done For You. We will make sure you get this free copy of the Navigating Medicare. That Medicare Done For You appointment is at zero cost. And again, I will stay here. I will answer questions for as long as people have them. I do see that someone is typing here, so we will let that get in there. Okay, so looks like, okay, there's a couple more coming up. So again, another thank you. So you, Keith, not turning 65 until January 2022. Okay, so that's good information to have. Good time to start the thought process of this for you is probably going to be end of September, because that's when we will get our information on the 2022 plans, and we want to make sure we have accurate information for you. So we look forward to hearing from you and seeing you then. Elaine, you're certainly welcome. We are very glad you could attend our workshop this evening. Again, every one of you, we're glad that you could be here. So again, going to stay here. If there's any more questions, we'll give it a minute or two for anybody to fire the last questions in there. If we have no other questions, though, in the last few seconds, we're going to end it up. Again, I do want to remind the Navigating Medicare booklet, and we're glad to see you to answer your questions. And if you think of something, okay, and want to give us a call, shoot us an email. That is perfectly okay as well. We want to be here and be a resource for your Medicare needs. So it looks like the typing and the activity on the questions has stopped. I'm going to wrap it up here. We're going to end the meeting. Again, I'm going to thank every one of you that was here this evening. And if I cut it off too quickly, then again, please give us a phone call. Shoot us an email, and we'll take care. Thank you. Have a good evening. Be safe. Enjoy this warm weather this evening, and we'll see you when it's time for Medicare.